Wave 3 listens live. I'm Michael Vanover, joined now by another familiar face of the program. Dr. Regan Ackerman from Freedom Mini Dental Implants is joining me. Dr. Ackerman, it's good to see you again.
Hi, thanks.
Thanks for being back. It's been a while since we've done the show together, but I always enjoy it.
You know,
a lot of education, and I know our viewers at home really enjoy the information as well. And actually, a lot of them, they like to call in and ask you questions, so please feel free to give us a call if you have any questions for Dr. Ackerman. But first, for the folks that are tuning in maybe for the first time that are not familiar with Freedom, if you could give us a little bit of background on exactly what you provide.
Right. So at Freedom Mini Dental Implants, essentially I do a dental implant, but it's a small diameter implant. So it is a lot less invasive implant, a lot less healing time, and usually, you know, about half or third of the cost of the big surgical implant. And what we do with these mini implants is definitely help. A majority of people are denture wearers. They are using that denture glue, trying to keep their dentures in, and they're miserable. So we do, I know we'll show the models later, but several procedures. We do a snap-in denture where the dentures snap onto these mini implants, get rid of the denture glue, can eat better and a lot more stable, or we can get rid of the denture completely with the mini dental implant. And we also do single teeth, or, you know, just if you're only missing 2 or 3 teeth, or you have a partial or flipper. So we replace teeth with these mini implants, and they're just a lot less invasive way. You don't have to do bone grafts and sinus lifts, and it's not major surgery like the old way.
Well, and I think what's amazing to me, and every time you come on the show, we talk about this, is the quality of life that you give back to these people.
Yes.
And I don't think that we can say that enough. I mean, there are people that won't go to certain restaurants, won't eat certain things, right? I mean, you hear it all the time.
I hear it every day. They have to order certain foods off the menu, or they have to excuse themselves to go to the restroom to reapply their denture glue. You know, I had a patient the other day just telling me a story. She's like, you know, I was eating, and right in the middle of my meal, my denture came out. So we were doing a snap-in denture for her, so she didn't have to worry about that anymore. But it can be life-changing. You know, near and dear to my heart, actually, yesterday I saw a patient. We were kind of crying tears of joy together because he had been struggling for about 4 years before he saw me. Could not wear a denture at all, and we were able to do the permanent teeth for him, and he was smiling, tasting food, eating again, and just ecstatic, and his struggle was over.
Yeah, I mean, that's amazing.
Yeah,
See,
it's life-changing.
You're passionate. You're getting emotional right now. I love that. I love that. That's how you know you love what you do. There's no doubt. The phone number on your screen in the blue box there, 571-5263 is the phone number. If you have any questions for Dr. Ackerman, I know I have several for today. You really, again, you talk about how rewarding it is, and you touched on the fact that it's more affordable, but it can save people a lot of money. Can you touch on that a little more?
Yes. So, you know, a surgical implant can take a lot of time. It's, you know, stitches, and sometimes you have to go to, you know, 2 or 3 different dentists. So the mini implant, it's, you know, a smaller diameter implant. And like I said, you know, like for a single tooth, usually the cost of a mini implant is about half or a third of the cost. You know, and I see people come in with, you know, big treatment plans to replace all their teeth with surgical implants, and you know, we go over cost, and it's more affordable, it's in their budget. We do offer financing plans for sure, to get a monthly payment if you need that, and the consultation is free. All you have to do is call. We do a 3D x-ray at no charge, because we want to make sure you're a candidate, that you do have enough bone. And that is one thing we always say. It's pretty rare that I have to tell people they're not a candidate. I'd say like 95% of the patients that walk in my office are still a candidate for the mini implant. Now, they may have been told they didn't have enough bone for the surgical implant, but they could still be a candidate for the mini implant. So the consultation is free. So if you're wondering if this is for you, it doesn't hurt to make, you know, the appointment for the consultation. We'll go over your options and if you're a candidate and what the cost would be.
Yeah, somebody sitting at home right now, they may think, you know, I probably am not a candidate. Well, you hear that number, 95%. That's obviously a vast majority of folks.
It's pretty rare that I have to tell somebody that, you know, I don't have a solution for them.
Freedomimplants.com is the website. 502-937-4930 is the office phone number. But again, if you have any questions for Dr. Ackerman, give us a call, 571-5263. One thing that interests me, Dr. Ackerman, as well as I've kind of prepared for today's interview, is the link between the loss of teeth and other major medical issues. Can you talk about that? Because I think sometimes people maybe don't realize the correlation there.
Yeah, it affects your overall health. I've had numerous patients tell me, they can't chew up their food anymore, and so they're not getting the nutrients out of their food anymore. Or they're, eating a high sugar diet because they can't chew the salads and the fruits and the vegetables that they want to eat. It could lead to diabetes, what you're referring to, a lot of other systemic issues. So loss of teeth, isn't just aesthetics and losing your smile. A lot of it is function and being able to digest food and live a healthy life.
Now, how long, if somebody's thinking about this and they've maybe gone through all different sorts of dentures over the years and different things, what kind of longevity are they going to get out of this? Is this going to last them a long time, or is it, what can they expect if they go through the process?
Yeah, certainly. So the mini implant, people always ask me that longevity-wise. I have patients that have had their mini implants for 15 plus years, 20 years. So, Dr. Stroud was here before I was, so I see a lot of those patients that still have their mini implants. They're made out of the same titanium as the surgical implants, so they can, last just as long. It all depends on everybody's wear and tear. I always tell them, if you're using them within reason, everything's going to last longer. But they definitely last, as if you're using them within reason. And we go over all that.
Yeah, no doubt. And we talked earlier about, the ability to go to a restaurant and order things that you haven't got. But it also helps, with speech. It helps with that personal confidence for these people. And again, we can see how rewarding it is, talking to you, because your passion comes through. But, these are oftentimes things that people that don't have these issues just don't think about. Would you agree?
Right. There are so many denture wearers out there. You may have a family member that is struggling with this.
And they don't even know.
But you don't know it. They're silently suffering. Like you said, they either can't taste their food anymore, or, they're worried about them falling out, or, so many things. And that is, the two procedures we do, the snap-in denture. A lot of times we can trim out kind of the roof of the mouth. If you have a denture, you know what I'm talking about. Or we get rid of the denture completely, where you have nothing on the roof of your mouth and you get to taste your food. And like you said, your speech can improve because you don't have a denture in your mouth anymore.
Right. So again, you talk about silent suffering. That's got to be a thing, and that you see it on a regular basis. What would your advice be to somebody that's maybe watching right now? Obviously, if they are the denture wearer, give us a call, 502-937-4930. Again, if you have any questions for Dr. Ackerman throughout the show today, 571-5263. But what would you talk to about family members that have loved ones? Would you suggest that they talk to them? How would they handle that delicate situation?
Yeah, I mean, the biggest thing is, I see so many people that are, I don't want to say ashamed, but they come in, they're embarrassed, ashamed. You are not the only one in your situation. And for that family member, just make your family member realize they are not the only one in this situation, and it's nothing to be embarrassed about. Please call and make the consultation, because this is what I do every day and help people in that situation. So it's definitely worth making the consultation and see if we can get that family member in a better place.
Well, and there's options. I think people don't realize some of the options that are out there, and that's part of the reason I know you love coming on the show, giving people that education.
Yeah, and there's people that have worn dentures for like 10 years, and so they haven't been maybe to a dentist in 10 years, and they didn't know that this option was out there for them. Maybe they were told they weren't a candidate for surgical implants, but now you can be a candidate for the mini implants. And I see a lot of patients that have been wearing dentures, 10 plus years, come to me, and they finally discovered me and know that this option is out there for them to get in a better place.
All right, well, when we come back, we've got a lot more to get to with Dr. Ackerman. We're going to go over the different items that she brought right here that you see on your screen, as well as some before and after pictures. More to get to on Wave 3 Listens Live. When we come back, stay with us.
Tim Jones back for Toyota of Louisville. Choose a 2021 Toyota Corolla and get a 36-month lease with a payment of only $139 a month. And we want your trade-in. Dixie Hwy or ToyotaofLouisville.com, a Swope dealership where nobody walks away.
Erectile dysfunction for men of all ages has become much more common. In fact, most men don't realize that 90% of erectile dysfunction is a direct result of broken down old blood vessels. This causes a lack of blood flow that is critical when achieving an erection. With our state-of-the-art technology, we're able to stimulate new stem cell growth right in our office with no pills, no needles, no surgery, and no pain.
To book your consultation and get back to natural functionability, call Peak Performance for Men today.
Getting bit by mosquitoes is the worst. These guys at Mosquito Hunters felt the same way. Just call they'll spray, and then the party is on. And if you see a mosquito, call, and they'll come back and spray again, because that's how it should be. So don't wait. Take care of your mosquito problem today.
We're helping you to take back your yard. Mosquito Hunters.
It's Sleep Outfitters Memorial Day Mega Sale. Save up to $800 on adjustable mattress sets, or buy this Sealy adjustable base and get this Sealy Slumber mattress free. This week only, get a smart robot vacuum, up to a $300 value, yours free. Plus, get any size mattress for the twin size price. Kings and queens as low as $299. Get interest-free financing for up to 6 years and free premier delivery. Mega comfort, mega savings, only at the Memorial Day Mega Sale. Now at Sleep Outfitters.
This weekend, 0 down delivers on the pre-owned lot. I'm Tim Jones, back for Toyota of Louisville with an update. And we also offer second chance finance if you've had past credit problems. Dixie Hwy or ToyotaofLouisville.com, a Swope dealership where nobody walks away.
Welcome back into Wave 3 Listens Live. I'm Michael Vanover, joined again by Dr. Ackerman with Freedom Mini Dental Implants. And Dr. Ackerman, we've covered a lot of stuff in the first segment, really, rewarding stuff for a lot of these people, and we're educating the community, which we love. But you brought some models today that we're going to go over.
Yes.
So if you can kind of take me through what you brought today and what we're looking at.
Yeah, certainly. I think the models definitely help make sense kind of how these mini implants work. So the first model I will show is what we call snap-in denture. So this is, for anyone wearing a denture that wants to get rid of that denture glue and have a more stable denture. So, imagine this is your mouth without teeth, and then these are the mini implants. And when I place these implants, I'm not making any incisions or stitches. I just numb up the gum a little bit, little anesthesia, and then no incisions or stitches. And then the nice thing about the mini implant is that same day I put the implant in, I will put these attachments inside your denture, and then you leave that same day with your denture snapped on to the implants. So then no more denture glue, no more denture flopping around. You can eat a lot better. Your denture is so much more stable with this snap-in denture. And then a lot of times too, as this model shows, we can trim back the denture a little bit on the roof of the mouth, which helps out people that have gagging issues. It can help you taste your food a little bit better. So this is a great option. If you have a denture and you're just looking to, keep it in better and get rid of the denture glue. So this is what we call the snap-in denture. It's one of the most common procedures I do. The other procedure that we do, we kind of call this the permanent teeth, where you get to throw those dentures away completely. So same thing as far as, these are the mini implants. Imagine this is your mouth without teeth. Place the implants the exact same way, no incisions, no stitches. We're just going to place more implants, but then we're able to make this bridge of teeth. And as you can see, it's a lot less bulky than a denture. You get rid of all that plastic. And this bridge, this is the important part, it gets cemented on to those implants permanently. So it does not come in and out of your mouth anymore. It's kind of like growing your teeth back. It's the closest thing to getting your teeth back. But then you really have nothing on the roof of your mouth. You lose all that plastic of a denture. Obviously eat better, taste your food better. We give you a water pick to kind of help keep it clean, and obviously you're going to brush it at home and take care of it. But this is definitely one of the nicest things we do because you get rid of the denture completely. So,
wow, I love what you just said. That's the closest thing to growing your teeth back. There we go.
And we don't do just dentures, even if you're missing one tooth, a single tooth, or 2 or 3 teeth. So I'll show kind of my last teeth model here. And this shows, I see so many people that have been missing a front tooth, a sports injury, or maybe they were born without it, and maybe you have a flipper or a partial, and if you have one of those, you know what I'm talking about because they're miserable. They don't stay in, they come in and out. So we can do a single tooth, place the implant the same way, and then we make, the nice pretty crown, and then it gets cemented on to that implant, and it stays in permanently. So like I said, I had a patient tell me this. They said, I feel like I grew my tooth back, and so I love saying that. It just, it's like you grew your tooth back. And then same thing, I have a lot of patients that are missing their molar teeth in the back. they're big chewers, and they miss chewing steak and being able to, chew food, and hate using just their front teeth. So we can do, just 2 or 3 teeth at a time as well. We're just going to place anywhere, 2, 3, 4 implants, and then we make a bridge of teeth, and this gets cemented on to those implants as well. It does not come in and out. It stays in your mouth. You brush it and floss it just like you would your regular teeth. So we can do, a whole mouth, 1 tooth, 2 teeth, just depends on what your situation is.
Well, and let's talk about that a little more, if you don't mind. It's not a one-size-fits-all.
No.
When people come in, everybody's got different issues going on.
Yes.
You really look at it from a customized approach. Can you elaborate on that a little bit more?
Certainly, and that's all part of the consultation, because we'll take that 3D x-ray. It's no charge. I'll go over all your options and costs, because just like you said, everyone's situation is different, and everyone's wants are different. I have some people that come to me and they're like, I'm totally fine with my top denture. I just really hate this lower denture. It is flopping around. I need a better solution. So we just focus on the lower. So, it's teamwork. We listen to each other and see what your priorities are, and that's where we start.
All right, I want to take a look at some before and afters. I know we teased it earlier. We're going to look at a picture, I believe, from Ronnie.
Yes.
And tell us what we're seeing here.
Yeah, so Ronnie came in like so many people. He had dentures made, and he just couldn't wear them. He was actually the opposite of a lot of people. He couldn't wear his top one because it gagged him so much, and he actually wore his lower denture a little bit. Usually it's that lower denture that nobody can keep it. But basically, for the most part, he wasn't wearing his dentures because they were gagging him, and they were just flopping around, and he couldn't keep them in. So we were able to do the snap-in dentures for him and get his smile back. And I saw him the other day, and he was so happy. He can eat again, smile again, and still taste his food. And the most important thing is that he can keep his dentures in. That was his biggest struggle, is that he just could not keep the dentures in. Even no matter how much glue he used, they gagged them, they didn't stay in. So we were able, we made him new dentures and did the snap-in denture, and he can keep them in all
Look
the
at
time.
the difference and the happiness on Ronnie's face.
Yes.
I mean, really. I mean,
Yeah.
you just tell. And again, I know you see that every day, but for people that don't, I think it's really
those
it's really
before
nice.
shots, it's hard to get smiles sometimes. And I have a lot of patients tell me when we take the after shot, I'm like, smile. They're like, I have to remember how to, because they have, they've been trying to hide their smile for so long. So they kind of have to retrain themselves to learn how to smile again.
Now, if you have any questions for Dr. Ackerman, if you're on the fence, if you've been thinking about this, or if you have any questions at all, 571-5263. We will be taking your phone calls throughout the rest of the show. And, of course, you can call the office. You see the number on the screen, as well as always visit freedomimplants.com. Dr. Ackerman, you talk about a lot of people not smiling. They haven't been able to smile in years. This is something that doesn't take that long, right? So take me through the process, if you don't mind. Somebody that's watching, maybe a lot of people don't want to call in. They get nervous. We get that all the time.
Yep.
But they're like, okay, if I call the office, what's the process look like? From the time I call to getting in, how long until I can have my procedure done? What's that look like?
Yeah, certainly. Like you said, it's kind of hard because everybody is in different situations.
Sure.
But usually if you call the office, we'll get you in within a couple weeks for the consultation. Let's just say, you've had all your teeth extracted and you're in dentures and you're miserable and you hate them. A lot of it just depends if those are actually good dentures and you like the way they look and everything's good and you just wish they stayed in. Pretty much the next appointment would be placing the implants and leaving with those dentures snapped in that day. So that's kind of the easiest, simplest solution. Sometimes I have people come in and, their teeth are failing them and they need all the teeth extracted. So there is, 3 to 4 month of healing time there, but, you'll never not be without teeth. We'll make a temporary or a denture, something for you while you're healing, and we'll go over that process in detail when you come in.
I love it. Explaining the process, making it as easy as possible.
Yeah.
All right, we've got more to get to when we come back with Dr. Ackerman. FreedomImplants.com is the website, 502-937-4930. We'll be right back on Wave 3 Listens Live. Stay with us.
Honey, finish the driveway.
Oh my goodness. Stay right there. Don't move. Luis would have done it right.
Charles DeWeese Construction can match any estimate for residential or commercial paving in Louisville and surrounding areas. Now hiring.
On time and in your budget, DeWeese does it right.
If you or someone you know has sold a home in the last 10 years, you've probably heard of radon. Radon is widespread and the second leading cause of lung cancer. If you're planning to sell or stay, call Verified Radon Safe. VRS's accurate readings will come back in just a couple of days. For a limited time, save $50 and get your home tested for only $149. Remember, your home isn't safe unless it's Verified Radon Safe. Call 502-91-RADON or go to verifiedradonsafe.com now.
Hey, it's Deanne Stevens. I'm here with Lisa Innenbach of 25 Again, where a better you begins inside. Lisa, what does that mean?
Well, we pride ourselves on changing the body chemistry inside so that you can actually lose that weight and keep it off, gain that energy. You're sleeping through the night. You're able to get out and do those things with your kids or your grandkids. You know, as you start to age, you start to lose those vital hormones. And it's like not putting gas in your car. You need some gas. That's what will get you going.
30 pounds in 30 days. Can we really do that?
I can't tell you how many times I've seen that in the past 10 years.
How does it work? What do? We start off by coming in, customized.
Now, yes, and now is the time. For just $99, which is normally $395, you're going to get 2 office appointments, lab work, a physical, and for the first 20 callers, we also going to throw in a free B12 shot for an entire year, 1 per month.
Check out what they can do for you by calling the number on your screen or online at 25again.com.
Welcome back into Wave 3 Listens Live. I'm Michael Vanover, joined again by Dr. Ackerman from Freedom Mini Dental Implants. And we actually have a caller on the line we're going to go to right off the top, if that's okay with you, Dr. Ackerman. We're going to talk to Mary Ann, who's dialed in. Mary Ann, welcome into Wave 3 Listens Live.
Thank you.
Hello. Go ahead for Dr. Ackerman.
All right, Dr. Ackerman, I had oral cancer, and I had chemo, obviously, and then radiation, and they had to remove all of my teeth, and I haven't been able to eat anything solid in 2.5 years. I have dentures, but they just don't work for me. Am I a candidate for the implants?
Yeah, so, you know, I know a lot of people have probably told you because of the head and neck radiation, you may not be a candidate for the implants, but I have been able to do it on several patients. It just kind of depends on how long ago the radiation is, and we do need to kind of talk to your physicians, but it may still be, you know, that you could be a candidate for the mini implant. Obviously, the first step would be the consultation, so I can do the 3D x-ray to make sure, you know, there is still enough bone there, and as long as you're, you know, healed up some from the radiation, we just have to go over that medical history and make sure, but it's definitely worth coming in for the consultation and seeing, you know, what your dentures look like, take the x-ray, kind of go over your medical history, how much radiation you had, and how long ago it was. But you may still be a candidate, so it's definitely worth making the phone call.
Thank you so much for the call, Marianne. We appreciate it. Also, during the break, we got a call from Susan in St. Matthews, and Susan said she was really nervous. You know, she's been thinking about, oh, how much does it hurt? You know, she hears horror stories about the surgical implants. Yes. Talk about the pain or lack thereof and the recovery for Susan, if you don't mind. She was too nervous to go on the air.
No, definitely. And, you know, a lot of people hear stories from other friends like, oh, I had a surgical implant and it was awful. So I see a lot of patients, and I always try to tell people, you know, once I put an implant in, I'm like, okay, that's an implant in. And they're like, really? That's it? I'm like, yeah.
You're done.
So it's not like, you know, if you've been through it, you know, it's not like a root canal. It's not like a crown. It is not like drilling. And, you know, I try to tell people that, but until you've been through it, you know, but once usually I get that first implant in, they're like, big sigh of relief, and they're like, okay, this is not bad at all. So you're right, the mini implant, it's a lot less invasive and is nothing like having a root canal or even just a filling with all the drilling and the noise and the sound. It is a lot simpler, less invasive, no stitches, no, you know, when you leave, you're not bleeding, no swelling. Most people, I tell them, you know, that first night's going to be a little achy, but, you know, within the, you know, 24 or 48 hours, a little achiness, and then after that, good to go.
Okay, well, that sounds great.
Yeah.
And then people like to hear that, so hopefully that helps Susan feel a little bit more comfortable. We've got another caller on the line. Jim joins us. Jim, welcome into Wave 3 Listens Live.
Yeah, I had some dentures put in about a year and a half ago, and I'm not happy with them at all, and I'm thinking about implants. How does your insurance work on that?
Yeah, so we are out of network with insurance, so you would pay us through a financing plan, but we still file your insurance. So the way it works, we do file everything we do to your insurance, and if they cover any cost of what I do, the implants or a new denture, they will send you the check in the mail. So we do still file your insurance with you, but we are out of network with insurance. So. Good question.
Jim, thank you so much for the phone call. We appreciate it. All right, Dr. Ackerman, you brought another model that we haven't got to go over with yet. So if you don't mind, show us what else you brought today.
Yeah, and this actually may make Susan in St. Matthews feel a little bit better, too.
Yeah, okay, perfect.
Because this shows the difference in implants. I don't know if you can zoom in because it's hard to see the little hole I make, but this shows the difference between the surgical implant. It's a much, much bigger hole. That's the one you can see really well. So that's the surgical method, the big implants. The little hole is the hole that I make when I place an implant. So a lot less invasive. And I think that helps put people's mind at ease, too, when they see the difference. But that's also why, people that were told that they had to have major bone grafting or sinus lifts, they can be a candidate for the mini implant because I don't have to have as much bone to place an implant as you do with the big surgical one. So I think this, model speaks volumes for itself and, how less invasive the mini implant is.
Well, I think that does a great job of explaining that. And, again, this seems kind of like a no-brainer. You're going to save some money.
Yes.
You're going to go through a lot less pain.
Yes.
And you're going to grow your teeth back.
It is the easiest way you could do an implant.
That seems like a no-brainer for sure. I believe we have another caller on the line. Sarah joins us now on Wave 3 Listen. Sarah, welcome into the show.
Thank you. I just had an appointment for regular implants, and I need 5 that are in the back. They're all molars.
Mm-hmm.
And my regular dentist is telling me that mini dental implants aren't good for molars because of chewing. Do you know if that's the case?
Yeah, certainly. So there's, some misconception because sometimes, a lot of dentists, they weren't trained on this in dental school or don't know exactly how we do the mini implants. They may think we're only using like one little mini implant to support a molar. But actually, when we replace a molar tooth, we use 2 mini implants to act like the 2 roots of a molar. So it's just as sturdy as, one big surgical implant. And I replace molar teeth all the time with the mini implants, and I see them last, 5, 10, 15 years. So they definitely can work. I understand his concern because the molar teeth we do chew a lot with, but we do use, 2 of the mini implants to support a molar tooth because it is a larger tooth. So, I definitely, invite you to come for a consultation, and I can kind of explain the difference and go over what the cost would be with the mini implant, which may save you some money as well.
Sarah, thank you so much for the phone call. We appreciate it. Okay, Dr. Ackerman, one of the questions that you get a lot, we were talking about this earlier today, is people afraid of their previous medical history, maybe having to stop medications, things like that. Talk about how that seems to not really be a concern with you.
Right, yeah. So with the mini implant, I know I keep saying it because it is less invasive and I'm not doing stitches or major surgery or anything. A lot of people come to me and they're on blood thinners. I do not have to take people off their blood thinners because I'm not making an incision or a stitch. So there's a lot of medications that people worry about, or maybe when you have a tooth extracted or a surgical implant, you may have to stop your blood thinner or certain medications, or you're not a candidate because of your medical history, but you are with the mini implant. And the biggest one is that I don't have to take you off a blood thinner.
All right, so Dr. Ackerman, we've enjoyed the conversation today. It's been awesome. But if people are watching again, they're thinking about taking action, it seems like the time is now. How is the best way to go about doing that?
So certainly just make the phone call to the office, and they will schedule the free consultation for you. It's usually, about a 30-minute appointment. We take a 3D x-ray, and I will go over all your options, and we'll go over the models and finances and cost. It doesn't bind you anything. It just shows you what your options are with the mini implant.
All right, Dr. Ackerman, Freedom Mini Dental Implants. Thank you so much for being here. It's so good to see you again.
Thank you. You too.
All right, great information as always from Dr. Ackerman. And coming up next on Wave 3 Listens Live, we're going to talk to Wave 3's own Dawn G about what's coming up on Wave Country today at 2 o'clock. We'll be right back.